Hello dear students, welcome to Ganesh Nursing Academy. So today I am going to discuss very important MCQs on placenta. Okay, so I will discuss both important MCQs on normal placenta as well as abnormal placenta. So this is very important session, okay, because in placenta they may ask many questions. Okay, so that is the reason why I have taken this topic for the discussion. Okay, so let's begin with the important MCQs on placenta. Okay, so before I begin with this session, I would like to tell you that there is a lot of call for me has been happened in ESIC, okay, AIMS as usual, okay, and Sanjay Gandhi Hospital. So many opportunities are coming. So all of you make use of this opportunity. Be serious with your career and prepare well and crack examination. Okay, so that we will also feel satisfied with your success. Okay, so let's begin with this session. Okay, so before this beginning of session, if you are new to my channel, please subscribe to the channel, and as well as you also share to your friends. Okay, so that I can also help, it will also help me to grow my channel. Okay, so let's begin with the important MCQs discussion on placenta. Okay, so let's discuss MCQs. First one is question number 1. Fetal surface of placenta is formed by. Okay, so here the fetal surface. Okay, so the fetal surface of placenta is formed by option A deciduobasalis, option B inner cell mass, option C chorionic frontosome, option D none of the above. Okay, so basically this placenta is formed by, okay, placenta is formed by, okay, this placenta is formed by, this placenta is formed by trophoblast cells. Okay, trophoblast cells. Okay, trophoblast cells. Now let us see here, this is a uterus, so here is the placenta. Okay, and we have a fetus here. Okay, so here this is the umbilical cord that is connected to the placenta. Okay, so umbilical cord that is connected to the placenta. So this surface, okay, so this surface is called a, okay, this surface is called maternal surface. This is a maternal surface, and this surface, okay, the surface which is lying towards the fetus, this is called a fetal surface. It is a fetal surface. Okay, so this is a maternal surface, the surface of the placenta which is lying against the uterus, that is lying against the decidua, so that is known as a maternal surface. And the surface of the placenta, that is, okay, the lying against the fetus, okay, that is facing towards the fetus, it is known as the fetal surface. Okay, this is the umbilical cord, all of you know that. Okay, so now they have called the fetal surface of placenta is formed by this is the fetal surface, this fetal surface. Okay, this side is the fetal surface, this fetal surface is formed by which cells they have asked. Okay, so the fetal surface of the placenta is formed by chorionic frontosome. Okay, so chorionic frontosome is the one which forms the fetal surface of the placenta, and maternal surface of the placenta, this maternal surface of placenta is formed by decidua basalis. Okay, so the fetal surface, this fetal surface is formed by chorionic frontosome, and this fetal surface is formed by decidua basalis. Okay, and what about this inner cell mass? Okay, so this inner cell mass, this fetus, the fetus is formed by inner cell mass, the fetus is formed by inner cell mass. Okay, so the answer for this one is the fetus, okay, the fetal surface of the placenta is formed by chorionic frontosome. It is formed by the chorionic frontosome, okay. Whereas the maternal surface is formed by the deciduobacillus and fetus is formed by inner cell mass, okay. And option D, none of the above is the wrong option here. So the answer for this one is, that is, the fetal surface of the placenta is formed by chorionic frontosome, okay. Basically the placenta is formed by the trophoblast cells. So this is the answer for this question, okay. Okay, dear students, let's see next question. Question number 2. Okay, the normal weight of the placenta is option A 300 gram, option B 500 gram, option C 800 gram, option D 1000 gram. Okay, so see the option and try to find out the correct answer here. Okay, so the normal weight of the placenta is, it is 500 gram. Okay, so 500 gram is the normal weight of the placenta. Okay, so these kind of direct questions will come in the examination. Most of the questions will be direct questions. Okay, so that is why you should know the answer for a one-liner questions also. It is very important that you should know the one-liner questions also. And next one is question number 3. What is the ratio of weight of placenta to the weight of fetus? Okay, the ratio of weight of placenta to the weight of fetus. Option A is 1:2, option B 1:3, option C 1:4, option D 1:6. Okay. So what is the ratio of weight of placenta? What is the ratio of weight of placenta to the weight of a fetus? Okay, how to calculate weight of placenta to the weight of this one? So here weight of a placenta, okay, divided by weight of a fetus. So weight of placenta is how much here? Weight of placenta is 500 gram, and the normal weight of the fetus is 3000 gram. Okay, now this 0 will go, this 0 will go. 5 ones are 5 6. Okay, 5 ones are here, 5 6. So that is nothing but 1/6. 1/6 is nothing but 1:6. So the weight of the placenta. So the weight of the placenta to the weight of fetus. The ratio of weight of the placenta to the weight of fetus is okay. That how we are going to calculate? That is weight of placenta divided by weight of the fetus. So weight of the placenta is 500 gram and weight of the fetus is 3000 gram. So when you calculate it, it will come 1/6. 1/6, that is a 1:6. So the ratio of weight of placenta to the weight of fetus is, it is option D 1:6 is the correct option here. Okay. Okay, dear students, let's see next question. Question number 4. When is the weight of placenta is equal to weight of fetus? Okay, that is the weight of placenta is equal to weight of a fetus. Okay, fetus. Okay. So when is the weight of placenta is equal to weight of fetus? Okay. Option A is 6 weeks, option B 12 weeks, option C is 17 weeks, option D is none of the above. Okay. So at 6 weeks the placenta start forming. Okay. So 6 weeks is not a correct answer here, because at 6 weeks formation of placenta starts here. So formation of a placenta starts at 6 weeks. It starts at 6 weeks. Okay. Now at 12 weeks, it is a phase where the complete formation of placenta will take place. Okay. It is a completion of placenta formation. So at 12 weeks, completion of placenta formation. Okay. So at 12 weeks, the placenta is completely forms. Okay. At 12 weeks, the placenta completely forms. At 6 weeks of pregnancy, the placenta will start forming. Okay. And next at 17 weeks. Okay. So it is a where, okay, the weight of placenta is equal to weight of a fetus. Okay, weight of fetus. So at 17 week of gestation, the weight of placenta is equal to weight of the placenta. Okay, weight of the fetus. Now option D is a none of the. Okay. So the question here is, what is the weight of, okay, when is the weight of placenta is equal to fetus? When is the weight of placenta is equal to weight of the fetus? Okay, so it is answer is at 17 weeks. Okay, at 6 weeks there is a formation of there is a onset of formation of placenta occurs at 6 weeks. Then placenta will be completely formed by after by 12 weeks, and at 17 weeks the weight of placenta is equal to weight of the fetus. Okay, option D is a wrong option here. Okay. Okay, dear students, let's see next question. That is question number 5. Which of the following is not a function of placenta? Okay. Option A, exchange of nutrients and waste products. Option B, exchange of gases. Option C, formation of hormones. And option D is a formation of milk. Okay. So they asked the question, which of the following is a not a function? Which of the following is a not a function of the placenta? Okay. First one is exchange of nutrients and waste products. Okay. So this is a, see here, this is a, here we have villi. Okay, and this is a maternal surface. This is a maternal surface here. Okay, so here it is a basal plate. Okay, it is a basal plate. Okay, so this is the deciduous basal is here. This is known as the space between these are known as villi. These are all known as a villi. Okay, these are known as a villi. Okay, and the space between these known as a intervillous space. The space here, no, this is known as intervillous space. Okay, and here the maternal blood vessels are okay. So the maternal blood vessels will enter into this intervillous space. Maternal blood vessels are enter into this intervillous space. Okay, so in this, so in the fetus, okay, in the villi there is a fetal blood vessels. So fetal blood vessels will enter into the directly into the villus. Okay, whereas maternal blood vessels are entered through the intervillous space. Okay, this is known as a villi. Okay, this is known as a villi. Okay, so here what happens here, when the maternal blood flows to this placenta, okay, this is the placenta layer. Okay, what happens here, all the oxygen, the maternal blood contains rich in nutrients. It contains rich in nutrients. Okay, and all the nutrients are entered into the fetal blood. Okay, all the nutrients, okay, the maternal blood which is rich in nutrients are entered into the fetal blood, and the waste product, okay, the waste that is generated in the fetal blood, it is exchanged into the maternal blood. Okay, the waste is generated into the fetal. The waste product which is present in the fetal blood is transmitted to the maternal blood, and all the nutrients which is present in the maternal blood are transported to the fetal blood vessels. Okay, fetal blood vessels. Okay, and like that, exchange of gases also take place here. Okay, the maternal blood is rich in oxygen. The maternal blood is rich in oxygen. Okay, that is diffused into the fetal blood, and the fetal blood which is rich in carbon dioxide is get diffused into the maternal blood vessels. So because of this, what happens here, there is an exchange of gases also takes place in the placenta. So exchange of nutrients and waste products also takes place in the placenta, and exchange of gases also takes place. And placenta is also produces hormones. Okay, there is one, okay, layer is called, here we have called one layer is there. This is known as a syncytiotropoblast. What is this? Syncytiotropoblast. Syncytiotropoblast. So this syncytiotropoblast is known as a, it is a factory of a placenta where the hormones are produced. Okay, so of course the placenta also produces the important hormones. That I will discuss what are the type of hormones that produces in the next questions. Okay, so formation of hormone or production of hormone is again one of the functions of the placenta. Okay, next option D, that is the formation of milk is not a function of a placenta. Okay, so placenta will never make a milk here. So option D, formation of milk is a, okay, it is the right answer here. Okay, so that is a, which of the following is not a function of placenta, they asked. So option D, that is a milk formation is a not a function of the placenta. I hope this concept is clear for you. Okay, dear students, see next question. Question number 7. Which of the following hormone is not formed by the placenta? Okay, so there are some hormones which is produced by the placenta. Okay, and they have asked which of the following hormone is not produced by the placenta, which is not produced by the placenta. Option A, estrogen. Option B, human chorionic gonadotropin. Option C, human placental lactogen. Option D, progesterone. And option E also is there, that is a luteinizing hormone, that is LH. Okay, so the hormone which are produced by the placenta are estrogen, okay, human chorionic gonadotropin, human placental lactogen, progesterone. All these are the hormones which are produced by the placenta. Okay, and this LH, okay, luteinizing hormone, it is not produced by the placenta, it is produced by the anterior pituitary gland. It is produced by the anterior pituitary gland. Okay, so it is not produced by the hormone by the placenta. It is a hormone not produced by the placenta. So the answer for this one is, that is E option, that is a luteinizing hormone. Luteinizing hormone is not produced by the placenta. Okay, it is produced by the anterior pituitary gland. Okay, you should say next question. What is that? Question number 8. When is the best time to do ultrasonography to locate the placenta? Okay, we want to know the location of placenta and when we need to do ultrasonography. If patients ask when I need to do an ultrasonography to locate placenta, so in that condition, what will be your answer? Okay, so option A is the first trimester, option B is second trimester, option C third trimester, and option D is a none of the above. Okay, so what is the first trimester? What is the duration of first trimester? When we can say the first trimester? Okay, so first trimester is nothing but a, okay, that is first 13 weeks, 6 days. Okay, this is first 13 weeks. Okay, 6 days of pregnancy. First 13 weeks and 6 days of the pregnancy is known as the first trimester. Okay, second trimester it starts from, okay, so 14 weeks to 27 weeks plus 6 days. So this is the duration of a second trimester. So the duration of second semester is begins from 14 week to 27 weeks 6 days. Okay, from 14 weeks to 27 weeks 6 days, it is the second trimester. And third trimester, it begins from 28 weeks to 40 weeks. 28 weeks to 40 weeks. This is the third trimester. Okay, now they have asked, when is the best time to do ultrasonography to locate the placenta. Okay, so when you want to do ultrasonography to locate the placenta, it is the best time to do the ultrasonography is in the third trimester. Okay, so ideally 32 weeks. So 32 weeks is a, okay, best time where we can do the ultrasonography to look at the placenta. Okay, so option C, that is the third trimester, is the correct answer here. Okay, dear students, let's see next question. Question number 9. When does the tertiary villi are formed? Okay, so in the formation of placenta, when does the tertiary villi are formed here? Okay, so this is the question here. Option A is day 13 after fertilization. Option B, day 16 after fertilization. Option C, day 17 after fertilization. Option D, day 15 after the fertilization. Okay, the formation of placenta, what happens here? This is the decidua. Okay, this is the decidua basalis. Okay, and here we have a finger-like projections. Okay, here we have a finger-like projections. Okay, so these finger-like projections, these are called villi. Okay, all these finger-like projections, all these finger-like projections, these are called villi. Okay, and in between these finger-like projections, there is a space. Okay, this space is called intervillous space. It is known as a intervillous space. Okay, and this space, okay, it is surrounded by, this space is surrounded by one layer. Okay, it is surrounded by one layer. It is called as a, okay, this is a one layer which is surrounded by this villi. This is known as syncytiotropoblast. It is known as a syncytiotropoblast. Okay, syncytiotropoblast. Okay, and this inside the syncytiotropoblast, okay, so here we have an cell. Okay, okay, here we have a layer of cells. Okay, so this layer of cells, okay, we call it as a cytotrophoblast. These are called as a cytotrophoblast. These are called cytotrophoblast. Okay, so what happens here on the day 13 after fertilization? On the day 13 after fertilizations, okay, there is a formation of syncytiotropoblast and cytotrophoblast. There is a formation of syncytiotropoblast and cytotrophoblast. Okay, so This is known as the primary villi. Okay, so the primary villi consists of, okay, this primary villi, okay, this primary villi consists of syncytiotropoblast and cytotrophoblast. Syncytiotropoblast and cytotrophoblast, that is found on the day 13. Okay, it is day 13 after fertilization. Okay, so the primary villi, okay, which consists of syncytiotropoblast and cytotrophoblast, which is found on the day 13 after fertilization. So the primary villi consists of syncytiotropoblast and cytotrophoblast, that is found on the day 13 after the fertilizations. Okay, and on 16 days after the fertilizations, along with the syncytiotropoblast and cytotrophoblast, there is a extra embryonic mesoderm is found here. Okay, so here and another layer is found here, that is extra unique embryonic mesoderm. Okay, so extra embryonic mesoderm is found here. Okay, so this extra embryonic mesoderm is found. Okay, so that is known as a secondary villi. Okay, so when we can call it as a secondary villi. Okay, so secondary villi, okay, secondary villi consists of a syncytiotropoblast plus cytotrophoblast and extra embryonic, okay, mesoderm, extra embryonic mesoderm. Okay, so this is found on the 16 days after fertilization, which is known as a secondary villi. So secondary villi consists of a syncytiotropoblast, cytotrophoblast. Apart from syncytiotropoblast and cytotrophoblast, there is a extra embryonic mesoderm. So along with syncytiotropoblast and cytotrophoblast, if there is a formation of extra embryonic mesoderm, then we call it as a secondary villi, which consists of syncytiotropoblast, cytotrophoblast and extra embryonic membrane, which is found on the day 16th after the fertilization. Okay, next, when we call it as a tertiary villi. Okay, tertiary villi, when it called, when there is a fetal blood vessels start running into the villi. Okay, these fetal blood vessels, when the fetal blood vessels starts, okay, entering into the villi of the placenta, then it is called as a tertiary villi. Okay, so this tertiary villi consists of tertiary villi consists of syncytiotropoblast, cytotrophoblast, okay, extra embryonic mesoderm plus fetal vessels, okay, fetal blood vessels. So along with syncytiotropoblast, cytotrophoblast and extra embryonic mesoderm, if there is fetal blood vessels that also runs into the villi of the placenta, then it is called as a tertiary villi. So tertiary villi are found on the day 17th. It is found on the day 17th after fertilization. Day 17th after the fertilization. Okay. So they have asked a question, when does the tertiary villi are formed? So tertiary villi are formed on the day 17th after the fertilizations, which consists of syncytiotropoblast, cytotrophoblast. They also consist of extra embryonic mesoderm and fetal blood vessels. These are all these are the fetal blood vessels. Okay, so this is nothing but a tertiary villi. So tertiary villi, okay, it forms on the day 17th after the fertilization. Okay, now what is the day 15th after fertilization? So day 15th after fertilization, what happens here? The maternal blood vessel starts entering into the intervillous space. Okay, so day 17th after fertilization, day 15th after fertilizations, the maternal blood vessels starts entering into the intervillous space. Okay, this is known as a uteroplacental circulation. So when they ask questions like when does the beginning of uteroplacental circulation, that is a day 15th after the fertilizations. Okay, when they ask the questions like when there is the onset of a fetoplacental circulation. Okay, so that is the entry of a fetal blood vessels into the placenta. So this is at the day 17th after fertilization. That is the day 17th after fertilization. So at the day 17th after fertilization only the fetal blood vessel starts entering into the villi of the placenta. So this is known as a fetoplacental circulation. The onset of fetoplacental circulation begins at the day 17, and the onset of a uteroplacental circulation that begins at the day 15th after the fertilization. So I hope this concept is clear. So what is the question here? So when does the tertiary villi are formed? So the tertiary villi are formed on the day 17th after fertilizations, which consists of syncytiotropoblast, which consists of syncytiotropoblast here, and cytotropoblast. Okay, syncytiotropoblast, cytotropoblast. Then it consists of extra embryonic mesoderm and fetal blood vessels, which takes place day 17 after the fertilization. I hope this concept is clear for all of you. Okay.